G6PD deficiency is a genetic disorder that most often affects males. It happens when the body doesn't have enough of enzyme called glucose 6-phosphate dehydrogenase. G6PD helps red blood cells work. It also protects them from substances in the blood that could harm them.
In people with G6PD deficiency, either the red blood cells do not make enough G6PD or what they do make doesn't work as it should. Without enough G6PD to protect them, the red blood cells break apart. This is called hemolysis. When red blood cells are destroyed, a person can develop hemolytic anemia. This can cause tiredness and dizziness.
Red blood cells that don't have enough G6PD are sensitive to medicine, food, and infections. When these things trigger a quick loss of red blood cells, it is called hemolytic crisis. In these cases, the symptoms stop when the causes are gone. In rare cases, G6PD deficiency leads to chronic anemia regardless of exposure to triggers.
What are the signs and symptoms of G6PD deficiency? Most people with G6PD deficiency don't have any symptoms. Others might have symptoms of hemolytic anemia if many RBCs are destroyed. There are 7 symptoms, and these can include: first, paleness. In darker skinned kids, paleness is sometimes best seen in the mouth, especially on the lips or tongue. Second, extreme tiredness or dizziness. Third, fast heartbeat. Fourth, fast breathing or shortness of breath. Fifth, jaundice, in which the skin and eyes look yellow. Sixth, an enlarged spleen. And lastly, dark tea-colored pee. Mild symptoms usually don't need medical treatment. As the body makes new red blood cells, the anemia will improve. If symptoms are more severe, a child may need care in hospital.
Foods that people with G6PD should avoid. Legumes and carbohydrates are the 2 main food groups that traditionally trigger G6PD deficiency symptoms. Legumes are plant products that include beans, peas, lentils, and soy. Faba beans, in particular, tend to trigger the side effects. The carbohydrates that cause the most problems include white flour, refined sugars, and high fructose corn syrup. Additional food products that can cause G6PD deficiency syndromes to appear include tonic water, items that use blue food coloring, and products that contain sulfites such as wine and dried fruits.
Triggers of hemolysis in kids with G6PD deficiency includes illness such as bacterial and viral infections, some painkillers and fever-lowering drugs, some antibiotics, most often with sulf in their names, some antimalarial drugs, most often those with quine in their names, naphthalene, a chemical found in mothballs and moth crystals. Mothballs can be very harmful if a child swallows one.
Who gets G6PD deficiency? G6PD deficiency is most common in males in African heritage. Many females of African heritage are carriers of G6PD deficiency. This means that they can pass the gene from the deficiency of one to their children or do not have any symptoms.
What can parents do? The best way to care for a child with G6PD deficiency is to limit the exposure to anything that triggers symptoms. Check with your doctor for instructions and list of medicines and other things that could be a problem for a child with G6PD deficiency. With the right care, G6PD deficiency should not keep a child from living a healthy and active life.